forecast is out, and it is not good. The message is simple. You better get a flu shot, and you better get it at 9:30. Just how bad will this year's flu season be?
Well, it's a question no one can answer for sure, but experts say there are some ominous signs that have many really worried we could be in for a very severe year.
The winter that just finished hitting Australia resulted in the worst flu season in that country's history, 4 times as many cases as the year before. Flu that circulated here last year ran from October to May, making it the longest flu season in a decade. The CDC estimates some 42 million people got sick. More than 61,000 people died from the flu.
Now, experts say the flu is notoriously difficult to predict, but stress, even normal flu seasons, typically result in tens of thousands of deaths.
Mystery surrounds President Trump's sudden trip to Walter Reed Medical Center this weekend.
The visit did not follow the usual protocol.
The president left the White House at 2:15 Saturday, looking casual with no tie and carrying a folder. He arrived at the renowned military hospital a half hour later. The unannounced trip caught the White House press pool by surprise.
We've got a really busy year ahead, as you can imagine, and so the president decided to go to Walter Reed and kind of get a head start with some routine checkups.
Patient shows up, somewhat of an unannounced surprise visit to the hospital. What's going on? What prompted this visit? It is really odd.
Flu. The first day of winter is still a few weeks away, but the start of flu season appears to be here with between 1.7 and 2.5 million flu-related illnesses already reported. And forecasts suggest that flu activity will continue to rise. There's a 40% chance it will now peak in December, which the CDC notes would be considered early. Do we know why it seems to be hitting early this year and what that means for the rest of flu season?
We don't know why flu season happens when or where. We don't really know any of these trends and predictions, what's going to happen. But what we do know is it's here. What we do know is it's early, and what we do know is we have a preventive shot.
You have all these strains out there, so I'm wondering, does one vaccine sort of like nip it in the bud?
The answer is no. We don't have a universal flu vaccine. The past couple of years, we haven't been great. Science hasn't been great at predicting it.
2017-2018 influenza season, there were 61,000 total deaths and 810,000 hospitalizations. So it's not something to take lightly. Dr. Bekosh, why are we seeing such an outbreak in the South so early and so strong this year?
Yeah, it's a little bit difficult for us to know why, but it's the groups that suffer the most from influenza are the very young, those above the age of 65, and people that have medical conditions such as asthma or heart disease or diabetes or obesity. And it's those same groups that the flu vaccine doesn't really work that well in. So if the healthy population would take a higher level of the flu vaccine, then we can provide that herd immunity. Over the past 3 years, the National Institutes of Health in the U.S. has really invested a large amount of money in what they call the Universal Flu Vaccine Project. And clinical trials are starting this year, so we're really... Well, there's 2 things that are happening right now that cause us to be a little concerned. Number one, the number of flu cases that we're detecting is much higher than we would expect to see at this point in time in any average year. And the strains that are causing the flu are ones that we would normally not expect to see until...
Flu is widespread at this point. And that's something to be taken seriously. We have had 24 deaths statewide so far.
And those deaths come as the entire state is seeing elevated levels of flu activity, according to the California Department of Public Health. Michelle Corson with Kern County Public Health says this year's season is more aggressive than usual.
They're saying that it's a little bit more than average of what we would be typically seeing this. You know, the one thing about the flu is it is unpredictable.
The Centers for Disease Control and Prevention says all areas of the country are seeing more cases of
the strep throat and flu-like symptoms.
The CDC says there have been 23,000 hospitalizations and 1,300 deaths so far.
We have had no deaths reported to us that are associated with the flu yet.
Now, Jessica Corson also told me that this time of year is particularly risky for flu because people are traveling and they're spending a lot of time with their family.
Pediatrics on Hudson, the flu season hit early and has hit hard.
We saw our first cases the earliest in September, but really mostly in October we've seen the biggest kick. And then the last 2 weeks we've had a significant uptick.
The flu season in the U.S. started earlier than in any of the last 10 years. Doctors were expecting that based on worldwide trends. CDC, there have been an estimated 9.7 million flu cases nationwide, resulting in 87,000 hospitalizations, 4,800 flu-related deaths, 32 of those children. His daughter has not come down with a flu that knocked him out.
I got sick, my wife got very sick. Paige here had a little fever, and yeah, it was bad.
Just because the flu season started earlier doesn't mean it will end any earlier. Last year it ran very long, and so doctors stress there's still time to get that flu vaccine.
Flu season is on track to be one of the worst in recent history. In terms of the number of people infected, flu is now widespread in almost every single state, and nearly 10 million people have become ill so far. 4,800 of those people have died. Pediatric deaths are double what they were this time last year, and Dr. Tara Narula is here to help us understand why. So 32 children have died so far from the flu this year. Why is it?
We've seen a shift in the predominant strain, which is usually influenza A. This year it's influenza B. That hasn't happened since the 1992-1993 flu season.
What are the more serious complications they can get?
So certainly pneumonia is one of the most serious and most frequent complications. They can also get encephalitis, which is swelling of the brain. They can also develop sinusitis or ear infections. Then there can be things like seizures or myocarditis, which is inflammation of the heart muscle.
Story about a little girl going blind.
That's right.
You know, you have an incident in your own house.
We do. We were away.
She had the flu shot.
My daughter had the flu shot.
How old is she?
She's 7. She got the flu while we were away on Christmas break, and as she was recovering, we thought, oh, she's getting better. She came into my room at night and said, I can't walk. My legs hurt. And she was crawling to the bathroom. Wow. At which point we discovered that, in fact, viral myositis or inflammation of the muscles of the legs can happen in children who. This is why it's so important to remind parents that this doesn't have to just be, oh, a fever and some respiratory symptoms. This can progress. This can be deadly.
So what should parents be looking for?
So certainly you want to look for signs of the flu, right? So fever, abrupt onset, cough, runny or stuffy nose, sore throat, headache, muscle aches. But also in children, they can have things like stomach pains or nausea and vomiting and diarrhea, abdominal symptoms. And then you want to recognize when things might be getting worse. So
the public health officials, you know. And if somebody dies from influenza, are we doing post-mortem testing to see whether it was influenza or whether it was COVID-19?
There is a surveillance system of death from pneumonia that the CDC has. It's not in every city, every state, every hospital.
So we could have people in the United States dying for what appears to be influenza when in fact it could be the coronavirus or COVID-19.
Some cases have been actually diagnosed that way in the United States to date.